A stroke can steal your life in silence. It can take away your ability to speak, walk, or even recognize your loved ones in just a matter of minutes. But what if I told you that your body actually tries to warn you, not hours before, not minutes before, but sometimes even weeks in advance? The problem is, most people miss the signs. And when the signs are missed, the damage is often permanent. Here's a simple truth. Not all strokes come crashing down with dramatic symptoms. Many begin quietly. No loud chest pain, no dramatic fall. Just a strange headache here, a little fatigue there. Maybe your hand feels a bit off, or your balance seems a little off today. Easy to brush off, right? But brushing it off could cost you everything. If you're over 60, living with high blood pressure, diabetes, or if you've ever had a heart attack, these signs might be your body begging for help, quietly, softly, but desperately. And here's the part that might save your life. Stroke survivors often say they felt something wasn't right days or even a month before it hit, but they ignored it. They waited. They thought it would pass. Please don't wait. In this video, I'll walk you through the 10 silent signs that your brain may be in danger. One of them is so common, yet so overlooked, it shocks doctors every day. Stay with me till the end. One of these signs might be showing up in your body right now, and you don't even know it.
Sign 1. High blood pressure. Let me ask you something personal. When was the last time you checked your blood pressure? Because here's the hard truth. High blood pressure is the #1 silent killer behind strokes. It doesn't hurt. It doesn't cause a fever. You can feel perfectly fine while your blood vessels are being damaged every single day. Most people think strokes come out of nowhere. But did you know that 77% of people who suffer a stroke for the first time already had high blood pressure and didn't know or didn't take it seriously? Here's what happens. Over time, high blood pressure weakens the walls of your arteries. That pressure builds and builds until a blood vessel in your brain either bursts or gets blocked. One causes a hemorrhagic stroke, the other an ischemic stroke. Both are life-changing. And yet, so many people ignore their numbers. I feel fine, they say, until one day they don't. If you're over 60, this is not a warning to brush off. Get your blood pressure checked regularly. Ask your doctor what your numbers mean. If you're on medication, take it exactly as prescribed. And if you've been avoiding treatment, stop waiting. High blood pressure may not cause pain, but it gives no second chances. Your first sign might also be your last.
Sign 2. Excessive fatigue. Have you been feeling unusually tired lately? Not just regular tired. I'm talking about that deep, bone-heavy fatigue that no nap seems to fix. You sleep well, but wake up feeling like you've been hit by a truck. You sit down to rest and you don't want to get up. Even simple tasks feel overwhelming. Now listen carefully. That kind of fatigue, especially when it's new, persists, and unexplained, could be more than just age or stress. It might be your brain warning you. A study published in the Journal of Neurology found that over 50% of stroke survivors experienced unusual fatigue weeks before the actual stroke. Think about that. Weeks of the body crying for help, and most people never realized it. Why does this happen? It's often due to reduced blood flow to the brain. When arteries start to narrow from plaque or clot buildup, less oxygen gets where it needs to go. Your brain works harder to compensate, and that strain shows up as exhaustion. If you're over 60, especially if you have high blood pressure or diabetes, don't ignore this kind of tiredness. It's not just getting older. It could be a silent sign of stroke or even a precursor to a heart attack. Sign 3. Mini-stroke, ray. Imagine this. You suddenly feel your arm go numb. Your words come out jumbled. Maybe your vision blurs. Then, just as fast as it came, it's gone. Everything feels normal again. You breathe a sigh of relief and think, that was weird, and you move on with your day. But here's what you need to know. That weird moment might have been a mini-stroke, what doctors call a transient ischemic attack, or TIA. And if that's true, then you were just given a warning, a serious one. A TIA happens when blood flow to part of the brain gets temporarily blocked. Symptoms are just like a major stroke, but they vanish within minutes or hours. That's the trap, because when the symptoms go away, most people think they're fine, but they're not. The CDC warns that 1 in 3 people who experience a TIA will have a full stroke, often within the next year, and sometimes within just days. If this has ever happened to you or someone you love, don't wait. Call your doctor. Demand a stroke evaluation, because that mini-stroke may be your body shouting, "Help me now," or something worse is coming. TIAs are not tiny. They are ticking clocks, and that clock is counting down. Your body knows something is off. Please don't wait to listen.
Sign 4. Vision problems. What would you do if your vision suddenly became blurry? Or if you opened your eyes and everything looked doubled, like a shadow was following every shape? Many people don't realize that sudden changes in vision can be an early warning sign of a stroke, especially if the change only happens in one eye or only affects one side of your visual field. You might notice it while reading, skipping words or lines, or while walking, bumping into objects on your left side. It may seem minor until it's not. Here's why this matters. When a stroke is forming, a blood clot or blockage can reduce blood flow to the part of the brain responsible for vision, or, in some rare cases, to the artery that directly feeds the eye. What's the result? A sudden, unexplained change in how you see the world. And this type of stroke, called an occipital stroke, can cause permanent vision loss if not treated immediately. But because it doesn't hurt, people often blame eye strain or aging. They wait, they sleep on it, and by the time they seek help, it's too late to undo the damage. If your vision suddenly changes, don't second guess it. Don't assume it's just your glasses. Get it checked right away. Your brain might be sending you its final visual warning before a major event.
Sign 5. Numbness or weakness in the extremities. Picture this. You reach for your coffee mug, but your hand slips. You try to stand, and one leg feels weaker than the other. You smile in the mirror, and one side of your mouth doesn't follow. It happens fast. No warning, no pain, just sudden numbness or weakness, often on one side of the body, the arm, the leg, or the face. And for many, it's the very first and most classic sign of a stroke. Here's the science. A stroke often affects just one hemisphere of the brain. That side controls the opposite side of your body. So when blood flow is blocked to the right side of your brain, the left side of your body may go numb or limp, and vice versa. This kind of weakness might last only a few minutes. That's why so many people ignore it. But don't. Even if it fades, it could mean a stroke has already begun, or that a TIA has occurred and a larger stroke is on the way. If you ever feel numbness in your arm,
or you can't lift both arms evenly, or your face looks off, call 911 immediately. Don't wait for it to get worse. When part of your body goes silent, your brain is crying out for help.
Sign 6. Sudden dizziness, balance issues, or loss of coordination. Have you ever stood up and suddenly felt like the room was spinning? Or found yourself stumbling, even though the floor was flat? Sudden dizziness, loss of balance, or poor coordination. These aren't just signs that you got up too fast. They could mean something far more serious. Your brain isn't getting enough blood. The part of the brain that controls balance and coordination is called the cerebellum. If a clot or blockage cuts off its blood supply, you may lose your ability to walk straight, grab objects, or stay upright. You might feel like you're falling, even when you're sitting. And here's what's terrifying. Many people think they're just dehydrated or that it's vertigo. So they wait, they lie down, they sleep it off. But the truth is, balance-related stroke symptoms often come without warning and can escalate fast. You may drop your keys, miss a step on the stairs, feel like your legs won't respond the way they should. These aren't clumsy moments, they're red flags. Especially if you're over 60 or have heart disease or diabetes, don't guess. Get help immediately. Your balance doesn't just vanish for no reason. When your body can't steady itself, it may be because your brain is starting to fail.
Sign 7. Speech problems, aphasia. You're in the middle of a conversation, and suddenly, the words don't come out right. You know what you want to say, but your mouth won't cooperate. Your speech is slurred. You can't find the right words. Or you say something, but it doesn't sound like what you meant. And then you panic, thinking, "What's wrong with me?" That moment might be more than confusion. It might be aphasia, a neurological symptom that often signals a stroke in progress. When a stroke strikes the language center of the brain, it disrupts your ability to speak, understand, or even form complete sentences. Some people sound drunk. Others can't speak at all. And the worst part? It often comes without pain, so the urgency gets missed. Slurred or broken speech is one of the top signs doctors look for during a stroke assessment. If you ever notice someone's speech suddenly sounds off, ask them to repeat a simple sentence. If they struggle or sound different than usual, call 911 immediately. Because here's the truth. Every second your brain is starved of oxygen, millions of neurons die. Speech problems may be the first and only signal that something devastating is unfolding. Don't wait for it to get worse. When the words go, your brain is going too.
Sign 8. Sudden confusion or trouble understanding speech. You're watching TV. Someone asks you a simple question, "What do you want for dinner?" And suddenly, you're confused. You hear the words, but they don't make sense. You try to answer, but your thoughts feel foggy, scrambled, or distant. This isn't just forgetfulness. It's not a senior moment. This could be your brain sounding the alarm. Sudden confusion or trouble understanding others is a powerful warning sign that blood flow to your brain is being disrupted, often in the areas responsible for language, memory, and comprehension. When oxygen is cut off, these mental processes begin to fail fast. One study published in Lancet Neurology found that more than 40% of ischemic stroke patients experienced sudden disorientation or mental fog before the full event. Some even forgot familiar faces, places, or how to perform simple tasks like buttoning a shirt or using a phone. If this happens to you, or you see it in a loved one, don't write it off as stress or being tired. It's not normal to suddenly forget how to follow a conversation. This could be a silent stroke in progress. When your mind feels like it's slipping, trust that instinct. Get help fast. Your brain may be trying to tell you, I'm in trouble.
Sign 9. Sudden and intense headache. You're standing at the sink, doing dishes, when suddenly, bam, a sharp thunderclap pain rips through your head. It's not just any headache, it's blinding. It stops you in your tracks. Your vision narrows, your heart races, and for a second, you think, am I having an aneurysm? Maybe you are. A sudden, severe headache, often described as the worst headache of my life, can be a sign of a hemorrhagic stroke caused by a ruptured blood vessel in the brain. It can also indicate an aneurysm that's about to burst. Either way, it's a medical emergency. This type of pain usually comes without warning. No gradual buildup, just an explosive, stabbing sensation that hits all at once. Some people also experience nausea, neck stiffness, or even brief loss of consciousness. And yet many older adults dismiss it as a migraine or tension headache, take a painkiller, and lie down. That delay can be deadly. If you're over 60 and feel a sudden, unfamiliar headache that feels different in intensity or location, do not wait it out. Don't drive yourself. Call 911 immediately. When your brain is bleeding, every second counts. Don't wait to see if it goes away. That unforgettable headache may be the last warning you'll ever get.
Sign 10. Other neurological symptoms. Sometimes, the warning signs don't come in the form of slurred speech or facial droop. Sometimes, it's a strange wave of nausea that won't go away, or a sudden episode of vomiting without any clear cause. Maybe you forget how to unlock your phone, or you walk into a room and forget why you're there, not just once, but again and again, in ways that feel different from normal forgetfulness. These subtle neurological symptoms, from memory problems to dizziness, from disorientation to feeling unusually off, can all point toward a silent stroke or a more serious event waiting to happen. Here's the scary part. These signs often appear days or even weeks before a full-blown stroke. They're quiet, they pass, and because they don't scream emergency, they're easy to overlook. Some people also report changes in mood, sudden anxiety, irritability, or sadness that seems to come out of nowhere. Others feel a strange sense that something's wrong, but can't put it into words. And while these symptoms could also stem from other issues, like low blood sugar or fatigue, they deserve attention, especially if they're new, sudden, or feel out of character. Your brain knows when it's under threat, even if it can only whisper. Don't wait until it screams.
Here's what no one wants to talk about, but you need to hear. Ignoring these signs can cost you more than just your comfort. It can cost you your independence, your memory, your mobility, and yes, your life. A stroke doesn't always come crashing down out of the blue. For many, it starts with a whisper, tiny clues your body sends day after day. A slip of the tongue, a weird headache, a moment of confusion. And when those whispers go unheard, the brain pays the price. Permanent brain damage, difficulty walking, trouble speaking, long-term care. It all starts with one decision: to wait or to act. And here's the cruel truth. Many people realized something was wrong after it's too late to undo it. After the stroke has already taken something from them: a voice, a memory, a future moment with family they'll never get back. If you or someone you love shows even one of these warning signs, don't gamble. When blood flow to the brain is interrupted, every second matters. Time lost is brain lost. Please don't give stroke a head start. If you're over 60, prevention is your strongest defense. You don't need to be perfect, but you do need to be consistent. Start with your blood pressure. Get it checked regularly and keep it under control. This alone can cut your stroke risk in half. Take your medications as prescribed. No skipping, no guessing. Second, get moving. You don't need a gym. A brisk 30-minute walk 5 times a week is enough. Third, eat smart. Fresh vegetables, berries, fish, nuts, and whole grains, these are brain fuel. Cut back on processed foods, salt, and added sugars. These are stroke's best friends. Fourth, stay connected. Depression and isolation increase stroke risk. Make time to talk, to laugh, to be around people you love. And finally, know your numbers. Cholesterol, blood sugar, BMI. Track them. They're not just numbers, they're warnings or victories, depending on how you act. You can't erase the past, but every choice you make now shapes your future. A stronger heart, a sharper brain, a better chance at the life you still want to live. The power is in your hands, starting today. If this video helped you, share it with someone you care about, a friend, a parent, a spouse, because the signs we just covered may be the only warning they'll ever get. Don't assume they already know. Most people don't. And if you've noticed any of these signs in yourself, don't wait. Don't brush it off. Don't hope it gets better. Call your doctor. Call 911. Get checked. Because when it comes to stroke or heart attack, early action isn't just smart, it's life-saving. Thanks for watching. Stay safe, stay strong, and we'll see you in the next one.